Hello, everyone, and welcome back to the podcast. So excited to be here with an outstanding leader in healthcare, Robin Goldsmith.
Thanks, Saul. Good to
Great.
finally be here with you,
man,
man.
it's so
Yeah.
great to be here.
Yeah.
A little context on Robin. He is the healthcare practice leader at Verizon, and we're here at Vive in Los Angeles recording this live. And my goodness, I just was so happy to be able to get time with you because you're so busy.
It's been a busy time. It's a good show, though. It's fun. Yeah.
So you guys have been doing podcasts here as well, right?
We have our Healthcare Owner podcast. We've had some really interesting people. Yeah, it's been fun. We have a booth with a podcast, so it's a good vibe. Yeah.
And I had a chance to catch your session.
Yep. We had a session with Ericsson talking about our connectivity infrastructure for hospitals, which is super relevant. So it's been good. It's been packed.
Well, you guys have been busy and been keeping up with you guys. So really, really great work. Tell us a little bit about you and about Verizon Healthcare.
Yeah. So I've been working with healthcare companies for close to 20 years. Joined Verizon 6 years ago during the pandemic. And when I was interviewing, I had that just realization of what we were all dealing with in the pandemic, looking at screens that all requires connectivity, devices, and in education and healthcare, those who were lucky enough to have devices and connectivity could participate. Those who didn't got left behind. So I was like, the telcos can do a lot in the space. And I didn't know telecommunications, but I knew healthcare and the challenges that we're going to talk about. I think we're foundational for a lot of that. So whether it's large hospitals, the networks there, or now more and more into the home, we know our place is the fabric of connectivity to enable a lot of what healthcare wants to do.
Yeah, and that's so important. For today's session, I know you guys serve the entire healthcare ecosystem, payers, providers, everyone involved. Let's focus on the payers or on the providers.
We're here. Yeah.
Right. We're here at Vive. It's Chime Health doing this. So what are the biggest problems you're seeing providers faced with?
I mean, margins are thin. We all know the workforce challenges. I think that the challenges around not having enough nurses and docs and even just IT people, I think everyone's stretched thin, thin margins. But they're also struggling with, I need the experience of my patients and my team to be elevated because they're competitive environments. You want to retain, recruit.
Yeah.
So all these macro trends, even the funding that's coming in, the legislation, for us as Verizon, that's a really strong tailwinds of what we're doing and our place in healthcare, because there's more and more devices, more cameras, more connected things in hospitals and now in the homes that's our wheelhouse. So, and it's, we work across every industry, but I think healthcare and manufacturing, to our highest executive leaders have been identified as places that are high priority for us, which is great to hear from me. And I think everyone recognizes that healthcare is different, it's special, it's complex. We need to train up our teams internally to really have better conversations with folks they're dealing with and not just, move from transactional vendor to be a strategic partner.
Yeah, totally. And that shift is important. What are you seeing that most people don't understand or appreciate that Verizon does in the health space?
Verizon and healthcare, not the thing you think about.
Yeah, right? Verizon, everybody knows Verizon.
Yeah, but we're not a healthcare company, but we are, again, foundational from a connectivity perspective. And if you just take 1 second to think about telehealth, remote patient monitoring, networks, things in hospital have to connect to a network. Yeah, of course, we're that fabric to do that. So a lot of the things we do in mining, oil and gas, manufacturing, they're relevant. And the innovation we do with the sports teams, the NFL, that's kind of our incubator for a lot of the innovation. We bring that to healthcare now.
That's cool.
But it's the hardest, but also the most rewarding.
Yeah.
In my humble view. So
and as you think about, one theme that's come up here at the conference is partnerships.
Yeah.
As you think about partnerships, are there any that you'd point to as like case studies or success examples that could be relevant for our viewers?
Yeah, I mean, it takes a village, right, to do things in healthcare, and I think everyone realizes that. And you have to work with the technology companies, the EHRs, to meet the needs of healthcare, both in the hospitals and in the home. Yeah, there's a lot, and I'm really excited about the the rural healthcare transformation. Has been kind of talked about a lot here at Vive, and so we're exploring. There's a collaborative that's been put together to, create this cohort of companies that are, coming together to, as the money flows from the states, and the providers get that money and they deploy it. A lot of it's for Verizon is, connectivity and devices and kiosks and access points. So we want to partner with a few of those folks to, provide an easy button, in essence, for when they do get that funding, they can use it quickly and they don't have to recreate the wheel to do what they want to do. So I think I was talking to a very large health system that is mostly rural. They're going to get their lion's share of that money. And they're super excited about it. And he agreed, a lot of the things they're doing are foundational to what Verizon does. So I think it's really, again, that tailwind, this additional funding will be good for everyone.
That's really great.
Yeah.
Just level the playing field, especially in these rural areas. I feel like we could finally make a difference there.
Yeah. I was at a surgical conference on Saturday, and it was really exciting because, I think we see these numbers, but when you hear it from like really smart surgeons, so if you look at the United States and, we're a first world country, think about this is the US versus sub-Saharan Africa, the number per capita of like critical care cardiologists, people that are able to do robotic surgery, we just don't have coverage. So robotic surgery, extending expertise to unmet needs, a lot in rural they said it's a humanitarian need. We have to do this because there's so much preventable death and strokes and getting, Rosa, we all know Rosa, Nurse Rosa about strokes. A lot of it's about time, and if you can intervene, and we got a lot of work to do, but I think technology is really going to bridge that gap.
So was that about like the future where we can do surgery remotely?
Yeah.
Oh, okay.
Yeah. China's doing it.
So it's happening today.
It's happening right now. China was, they're doing massive country, and they took through all the use cases. They're doing it all the time now. There's arguably one of the leading robotic surgeon who's doing this is Vip Patel. Everyone would agree he's the number one doctor in the world. He just did surgery in, I think it was Angola in Africa. So he's in the US, he's operating this robot.
That's amazing.
And doing like,
it's happening now.
And he just, think about that, the fiber under the ocean. I think it went via Brazil, like 7,000 miles from end to end. So we can do that. And then what they're looking at our network in Florida is how do we use that to do this in wider swaths of Florida, in Texas, Tennessee, Puerto Rico, wherever it is. We can do it 7,000 miles. We can sure as heck do it from California to Florida, right?
Wow. So there's actually like 7,000 miles of fiber under the ocean.
Oh, yeah. Yeah.
Wow.
Yeah.
And you don't think about that, right? Like you don't think about what goes into
transcontinental. Yeah.
making these types of things happen.
Yeah.
That's fascinating to me.
Hey, I know. It's amazing. He showed this crazy thing. So like, think about like a console.
Yeah.
And he was saying that the feel of these, the robot he's manipulating, it's pretty intuitive. And like he gets, it's got arms, and the big thing is latency. So when he moves the joystick, the time it takes to manipulate the machine, your brain will adjust, but the time has come down. It's 140 milliseconds. If it's consistent, your mind adapts. So TV has latency, but you don't notice because it's consistent. When there's jitter and it's inconsistent, then your brain notices. So we can now with our advanced networks, we can bring that time to sub 10 milliseconds. So that's faster than you can blink, faster than you could think. So that's the latency we're looking at with these advanced networks. So it's only, it's all coming. The world's moving more to wireless. So I'm excited about how we can impact those people who don't have access.
Totally.
Yeah.
Well, and leaders today are faced with just tough challenges, Robin. Like, what would you say Verizon's really good at solving, like for leaders trying to just make it happen day to day?
Yeah. I think we're trying to do a better job. And I think we've done a good job. We can always do better of just telling our story about what we can, because a lot of people know us for phones and tablets, but we have a whole wireline business. We do a lot of things in the healthcare industry. And I think we're making a big push to educate folks on how we can solve their challenges. And we're making a big push on, you hear our CEO all the time. We want to, really get back to, or, a strong focus on delighting our customers. That's a big thing across our whole business. And you've probably seen the advertisements, we're getting aggressive. We want to, continue to lead, be the number one provider. And I think now more than ever, we want to work with our customers to do right by them and provide not just, transactional relationships, but be a true partner.
Yeah.
And I think that's something that folks need to hear about.
So just going beyond the phones and tablets, like Verizon has so much more.
Yeah. I mean, security, big in-building networks. Like think about a stadium. We put those networks, whether it's Wi-Fi, private 5G, all the flavors of connectivity, we do all of that. We have a lot of fiber in the ground. We just acquired Frontier, which was big news.
Okay.
That expands that's a big deal because it expands our fiber footprint. So we're growing it. And we also do a lot around emergency services. We like to say we're first to the hurricane or the fire. We bring in vehicles, set up this, put up the pole and provide connectivity to, we did it in Asheville when that was hit by Hurricane Helene. Baxter plant was demolished, single point of failure for a lot of the liquids, the insulin bags. We got them back up. We created this mesh network around the city, and we're pretty proud of that.
That's pretty cool.
That's
pretty cool.
Yeah.
I feel like there's a lot we don't know, and that's why we do these types of things.
Yeah.
For our viewers to learn more about the capabilities of the leaders attending this conference. So
thank you for the opportunity, man. Thank you.
Thank you for being here with us. What closing thought would you leave folks with? And then where can they reach out to learn more about you and about Verizon Healthcare?
Yeah, no, I mean, we're excited to, like you said, healthcare is challenging. We want to be a resource. We want to be a good partner. We're trying to get out there, tell our story to our customers, engage with our customers. We're creating a lot of content on Healthcare on Air by Verizon, a podcast I host. And you can look us up, all our solutions, get a lot of great content on verizon.com/healthcare. But just reach out if you want to learn more about this. You got your local reps in your markets. We got coverage on that. But yeah, we're doing a lot out there.
That's great, Robin. Well, look, I appreciate it very much. Appreciate your insights.
Thank you.
For everybody out there, thank you for tuning in. We got Robin Goldsmith, healthcare practice leader at Verizon Healthcare. In the show notes, you'll find all the ways to get in touch with him, the different business units, the podcast that he runs, which is a very good one, and I highly recommend. Check him out. Check out the company. Now's the time. Did something in this episode resonate with you? Share it with your colleagues. That's another way you can make this useful to your network. Thank y'all for tuning in. And Robin, thanks for being with us.
Thank you, brother. Appreciate it.